this is Dr. Ken Starr with the Wellness Group in Arroyo Grande, California. I wanted to update a lot of questions we have about benzodiazepine detox and withdrawal and tapering. Most of the questions we get now from all over the country, especially the East Coast, are coming off benzos. And in my previous videos, I've stated that benzos are really unpredictable and they're very sticky. What do I mean by that? Our alcohol patients, our fentanyl patients, our opiate patients have a fairly predictable outcome, right? If you've been using alcohol very heavily, we know how to manage that withdrawal. We know how long it's going to last. When you're coming off heroin or fentanyl, that's also pretty predictable how long you're going to feel bad, when you're going to start to turn the corner, what those symptoms are going to be. With benzodiazepines, you have to throw out the rules. We have patients, or I've met or talked to patients that have used benzos like Ativan, lorazepam, Xanax, clonazepam for years, stopped it, and had no withdrawal or problems whatsoever. And we get calls from people who've taken those medicines 1 or 2 weeks and have spent the last year trying to get off of it. They're very sticky and they're very unpredictable. How are you going to respond? What kind of withdrawal are you going to have? Is it going to be anxiety, hot, cold, irritability? Sometimes these symptoms are totally debilitating that a lot of primary care physicians under-recognize or just don't understand. So let me really try to simplify this for you. If you're coming off benzos, you want to get off benzos, really you have to taper off. You have to transition to a long-acting benzo. So typically this is clonazepam or Valium preferably, but one of those two, something like that. So if you're on Xanax, you're on Ativan, first thing we do is try to get you on an equivalent dose of a long-acting benzo dosed twice a day, possibly 3 times a day. Why? We don't want interdose withdrawal. We want a nice smooth reduction and a very long duration of action. Now, and then we want to try to come down by no more than 10% every 2 weeks to 4 weeks. And even then, sometimes it's slower. So if you're like, oh, I'm going to go into a detox and just come off benzos in a week or 10 days, it's not going to go well. You're going to feel like shit and you're going to rebound. You're going to have horrible symptoms. Now, I run several detox programs. We do have patients who come in and they want to do that. And we certainly make the best of it if that's the decision you make to try to minimize medical complications and withdrawal. But I don't think it's the way to go. Some people, if you've got this blueprint and you're really sensitive to those reductions, this could take months or years. Now, what about the action manual, the action taper? In principle, that's probably a good way to do it. She was a little more conservative and slower than I think most people need, but there's nothing wrong with that. But if you look at those protocols, they're out a year or more, 2 years. So if you're on benzos and you want to get off a benzo, whether it's Xanax or Ativan or clonazepam, my recommendations, I'm saving a lot of phone calls and emails hopefully, is first try to transition, because if you're on a short-acting benzo, say like Xanax, it comes on, it comes off, it comes on, it comes off. It's very reinforcing and rewarding. We want something that's just going to be hair dryer. So these reductions are very tolerable and very manageable. And if they're done right, typically people can stay working, they can stay in school, they're functional for their families. But these are no more than 10%. And when I get these calls and emails, people are doing 25, 50% reductions. So I would try 10% reduction. Look, if you don't tolerate that, you need a 5% reduction. You might need to have a compounded product, but you have to have very small, tolerable, slow reductions. And you don't go down to the next reduction until you're stabilized. Your mood's good, your sleep's good, you're feeling okay, you're good, you're kind of have a new normal, and then you can try it again. Maybe that's a month, maybe it's 3 months. We've had patients with 2 or 3 months between reductions. Is that typical? No. But, this is not something where you're just going to come down 50% one week, 50% the next week, and you're off. Some people can do it, and I'm not saying you can't, but if you're one of these people who is having a lot of trouble, you have to do slow, measured reductions. Again, we do have a medical consult service if you want our opinion on it, but that's just what I'm going to tell you. So I think that's really the way to go. I hope that's been helpful. One of the questions is, well, I'm already on Xanax. Can I use that to taper off? No, because it comes on, it comes off. You're going to have interdose withdrawal. It's going to aggravate and accentuate withdrawal symptoms. What about medium-acting benzodiazepines like lorazepam? You know what? You could try it. It's fine, but I would use the longest-acting benzos around. Typically, again, that's Valium, clonazepam. even Librium or chlordiazepoxide you could use. But you have to have, but I like diazepam because it comes in really small doses that we can get, and it's very easy, it's much easier to work with. Okay, so does that make sense? All right, email me, call me if you have any questions. Thanks for watching. That's, in summary, how I would recommend people get off benzos, and good luck. Oh, and like and subscribe.